Hello there. It is my pleasure to provide you with some practical information to help you through your surgical journey. It is completely normal to feel nervous about the unknown. Together, we'll explore how to best prepare, what to expect, as well as the best way to become involved in your recovery of your upcoming surgery. You're watching this video because unfortunately, you have broken your hip and need surgery. Your recovery at the hospital will depend on your fracture, but you should expect to stay for at least 2 to 3 days. While you're waiting for your surgery, it is recommended that you have your family and friends to help motivate and support you throughout your surgical process. They can bring some items from home to the hospital that you need. Loose-fitting clothing and shoes with Velcro or elastic laces. Your leg and foot might be sore or swollen from surgery, or you may have bulky bandages over your incision. They can bring toothpaste, toothbrush, pajamas, a denture cup if necessary, and medications that you will take regularly in a labeled pharmacy container approved by your healthcare provider. Can bring a music listening device for entertainment, although this is optional. And they should take home any valuables that were brought with you to the hospital. You'll be staying in your bed until your surgery. The healthcare team will help you get washed and give you a bedpan when you need to go to the toilet. You may be having some pain when you're moving in bed. It is important to let us know how your pain is so we can give you medication to control the pain. It is important that we help you change your position in bed every 2 hours to prevent any sores on your skin. You'll be given a high protein and calorie drink regularly before surgery. These are extra nutrients to help you heal after the surgery. You'll be given an incentive spirometer by the nurse. They will teach you how to do deep breathing and coughing exercises. This is very important to do while you're in bed to help prevent pneumonia and other lung problems. Put your mouth around the mouthpiece and breathe in deeply with your mouth and relax the air out through your mouth. Use the incentive spirometer at least 10 times an hour while awake. If you feel like coughing, don't hold back. You will have some tests done before the surgery and be seen by a few doctors. You will only have surgery once the doctors feel that you are ready. The planned day and time of the surgery may change depending on how many emergency surgeries there are at the hospital. The night before your surgery, you will not be able to drink or eat anything after midnight. You may have an intravenous tube, called an IV, placed into a vein in your arm to give you fluids and medications. You'll be washed the night before and also the morning of your surgery by a healthcare provider. You may experience some confusion, called delirium. This occurs more often in older adults during a hospitalization. To help reduce the risk of delirium, your friends and family can do the following. Bring in a calendar and remind you what day and time it is. Bring in pictures of friends and family. Keep you company and talk to you. Bring activities that you like to do, such as coloring or word puzzles. Bring foods that you may like. And speak to the healthcare team about your usual activities. The day of surgery. It is important to note that you will not be put to sleep for the surgery, but will receive a spinal anesthesia. This is done through a needle in the lower back, which will freeze the sensation in the legs so that you do not feel any pain throughout the surgery. Spinal anesthesia is associated with reduced anesthetic complications when compared to general anesthesia. You'll be awake during the procedure and are welcome to listen to music through headphones if you so prefer. The anesthesiologist may give you a medication to help you sleep during the surgery, but this is not general anesthesia. Immediately after your operation, the healthcare team will typically focus on pain management, bowel function, diet, and early mobilization. After surgery, you may feel cold and have pain in your leg. The sensitivity to pain is different for each person. If you're having any pain or nausea, tell your nurse, who can help you get more comfortable and give you medications. If your mouth is dry, you may start drinking water. Feeling stiff or achy is also normal at this time. These feelings will go away when you can move around more. You will get out of the bed in the few hours following your surgery. The nurse will tell you if you're allowed to put weight on your leg or not. We will help you take a few steps and sit in a chair. If you feel faint or dizzy, call the nurse to help you get back to bed. You will be encouraged to urinate in the bathroom. If you have difficulty urinating, a one-time catheter may be inserted to drain your urine and then it will be removed. It is important that you continue to do your deep breathing exercises with the incentive spirometer. A proper diet will allow you to maintain normal blood sugar levels, which will help you recover faster and decrease the risk of post-operative infections. A recommended diet is one which is diet as tolerated or a standard diet and is started soon after surgery. You will continue to receive a high-protein calorie drink. You may need a stool softener, a laxative, or an enema to enhance a bowel movement. Passing gas or having a bowel movement will often take away gas pains. Walking around, gum chewing, and drinking caffeinated beverages can help make bowel movements come more quickly. The following days. Mobilization. On each day after your surgery, it is advised that, provided you feel well enough, you sit in the chair at least 3 times with intermittent rests on the bed as needed. You should aim to walk along the ward corridor. Being in an upright position, getting out of bed, and walking will help improve breathing, increase muscle strength, and decrease the chance of clots in your chest and legs. It will also help return your bowel function to normal more quickly. The nurses will continue to change your body position often in bed until you're walking more often. For your diet, you should try to drink about 6 to 8 drinks, or about 1,500 ml per day unless you feel sick or are told otherwise by your healthcare team. Each cup is usually about 150 to 200 ml. You can drink a variety of non-fizzy drinks while you're in hospital. Choose foods that are high in protein and fiber to help you heal and promote bowel function. You will be visited by a physiotherapist and an occupational therapist after your surgery. The occupational therapist may suggest equipment that is needed at home to help you do your everyday activities more easily and safely. The physiotherapist will teach you exercises that you can or your family can help you with to strengthen your muscles. They will also tell you about any movement restrictions, if you have any, and teach you how to walk with a walker. Most patients do not have any movement restrictions. To help reduce the risk of delirium or to help manage it, it remains important that your family and friends continue to visit you at the hospital. Criteria for discharge home for any patient undergoing orthopedic surgery includes tolerance of a regular diet, ambulation or ability to move, ability to go to the bathroom, and appropriate pain control. Start to arrange for help at home. Some things to consider include arranging who will pick you up from the hospital, getting any new required equipment at your home to help you move about safely, arrange the living space by removing any clutter on the floors that may make you fall, such as small rugs or cords, and to pre-prepare and freeze some food. To get into a car, always sit in the front passenger seat so you have space for your legs. Back into the car and sit down. Turn your body to face forward as you or your coach helps to lift your operated leg into the car. To get out of the car should be parked far enough from the curb to allow you to stand up with the help of a walker. Turn your body to face the door as you or a family member or coach helps to lift your operated leg out of the car. Step down to the street and up to the sidewalk. Don't try to straddle. To make the turning easier, you can put a plastic bag on the seat or a cushion. Avoid small, low cars and high SUVs. It may be easier to get into and out of a regular car and use a cushion if you need to make the seat higher. Driving. You should not drive until you're confident that you can drive safely. You can start driving 2 weeks after your surgery. If you have any concerns, check with your orthopedic surgeon. A good yardstick for this is when you've resumed most of your normal activities and are not on any strong painkillers. It is important that any pain has resolved sufficiently and that you are not taking any medication that would interfere with your ability to react appropriately in the event of an emergency on the road. Diet. A balanced, varied diet is recommended. Try eating 3 or more times a day. To avoid constipation, choose foods that are high in fiber and drink plenty of fluids. It is still important to obtain an adequate amount of protein and calories to help your body heal. Medication. You'll be given a prescription when you leave the hospital, which will likely include an anticoagulant, which helps decrease the risk of blood clots, and pain medication. The anticoagulant pill will be taken daily in order to reduce the risk of blood clots. You will also be prescribed pain medication,
A balanced,
including
varied
Tylenol,
diet is recommended.
and a painkiller if the
Try
Tylenol
eating
is not
3 or
enough.
more times a day.
It is advised
avoid
to take the
constipation
Tylenol first.
Choose
and
foods
only
that are
fill the
high in
prescription
fiber
for the
and drink
painkiller
plenty of
if your
fluids.
pain is still
It
not
is still
adequately
important to
controlled.
obtain
an adequate amount of protein
If you choose
and
to fill your
calories
prescription,
to help your body
but
heal.
do
not finish the medication, you need to return any unused pills back to your pharmacist for proper disposal. Getting dressed. For your safety, you should dress and undress your lower body from a sitting position. To put on pants or underwear, start with the leg that was operated on. To take off pants or underwear, start with the non-operated leg. Hobbies and activities. You should consider taking up your hobbies and activities as soon as possible again after surgery. This enables you to maintain your activity and will benefit your recovery. You should not need to restrict these unless they cause significant pain or involve movements that you were instructed to avoid. Sexual activity. You may resume sexual activity when you feel comfortable. You must still follow your movement restrictions to prevent a dislocation if you had a hip replacement surgery. Tiredness. It is frequent to feel low energy levels following surgery and anesthesia. It is important to mix activities with some rest as needed and to get out of bed each day and get dressed if possible. Sleep. If you had a hip replacement surgery, you can sleep on your back. If you put a pillow in between your legs, you can sleep on either side. Lastly, you must tell your dentist or other doctors that you had a surgery. Your dentist or doctor may treat you with antibiotics to prevent an infection. In summary, to enhance your recovery, you will greatly benefit from returning to normal gradually and as quickly as possible. This means that you need to actively participate in your recovery by moving, eating, and drinking. Each day you should feel some improvement, but do ask your healthcare provider if you're worried about something. You can refer to the list of products on precare.ca for your specific surgery as an example on what you need for your surgical preparation and recovery. On behalf of the Precare team, we wish you the absolute best on your journey.